All right, so we are getting organized for 2025. Very excited here to just walk through primary record, and I'm going to go from the very beginning and all the way to kind of what big rollout we're going to be doing here on Monday for all of our current family customers. So hang in there with me. I've got a few people on, and they'll use their hand if they've got specific questions. And obviously, you can always write to us at support@primaryrecord.com if you're still want some support and helping getting started. So let's share a little bit of hopefully where you've already have accomplished, and that is getting a primary record account started. So we're very excited. We are in the final stages of testing for primary record and getting in the Google Play and Apple stores. So our families are testing that for us to make sure nothing weird happened when we changed our code over into those apps. And so we're excited that we'll be in the store here probably February. And at the time, though, really the starting point is always primaryrecord.com. From there, you can learn about us for under the 4 families. And under here is where you can get started. And when I click that, it's going to probably log me into my family one. So I'm going to sign out so you see what it looks like. So this is kind of the screen where you will create an account. So I'm going to go ahead and just create an account so folks can see that experience. Webinar@primaryrecord.com. And I hate coming up with passwords, I'm sure like everybody else. And we'll just get that in. And when you create an account, we'll get the confirmation code and we will input that and we will be rolling, and we'll go from the beginning of getting started. I know one of the hardest things I think with, any new system or thing that you start using for your family is getting everything in one spot. And so we'll go through and give some tips and tricks, but at the end of the day, this is a lot of what nurses also deal with when families, when your family member hits our places of care and we don't have them on our electronic health record. It's all starting from the very beginning. So the goal is afterwards, it will be easier because now it's all in one place. We always ask and kind of get a sense of who you're managing. So we're hoping to give some guidance along the way. So we're, really specific if you need certain advice on supporting a family or just yourself. Here is the welcome screen. And we give a few tips here of, getting your first medical profile, the portal. So I'm going to be following a lot of these things. So let's begin. And at Primary Record, we're a family-centered app. So a lot of folks will just do this for themselves at first to check out what this is, or you can do it for someone else. So if you're taking care of a complex child, or if you've got an aging parent that their patient portals because they have trusted you with this information and you work closely with that family member or that older parent, then you can do it for them. And just kind of sharing what it does and helps you as you kind of navigate our healthcare system. So I'm going to do myself just to kind of show everything. And you can personalize, this and, having a picture. This can all be done on your phone as well. The sex and gender helps us we help reporting out, right? So if you have a gender that's, you want your medical team to honor, then it's a great place to put that in. So when we are doing reports on your behalf, we can relay that information, but not mandatory. And now we have our first profile. So something to realize is you're going to have an account on Primary Record. So you're the organizer, right? So you can then start making profiles. So you want to make your own, as well as those that you might be in your care. And so when I hit continue, it's going to automatically plop me into this first profile of my family that I'm going to create. And when you look at this, this is where we want to see how can we help fill this information as quick as possible for you. So one of the benefits at Primary Record is we lean into a new law called the 21st Century Cures Act. It made our medical information more electronic. So all of these electronic health vendors that all of our doctors and our nurses are using now are required to share what's called a patient access API, so that applications that you choose and trust can now get that information out of those systems so that you can create your longitudinal record about you and your family. So before we kind of get anything else organized, because that can take sometimes up to 3 hours ingesting lots of medical information, let's see if we can get a portal connected. And so what you're going to look for is connections. And under connections, we have a partner called OneUp Health, who is the person that has works with the different electronic health record vendors and gets approval and helps us facilitate that transfer of information into our application. So when you go to connect to a patient portal, you're going to search for health systems. We are connected to a few health plans because, if believe it or not, health plans also sometimes have labs and medications and conditions listed about you. And sometimes you'll find your doctor's office. So I always tell folks to start with kind of that local hospital office, or if you've got a MyChart, that's kind of who you're looking for, is who's your MyChart at and what's the name of that hospital system. So for me, I have attended, and actually my primary care is at what's a large academic center here in Indiana called Indiana University Health. And I'm going to go off screen so no one sees my password, but I'm going to go through and I will talk out loud at that process. So what's happening now is I've selected IU Health. So you're going to select your portal, and it's going to take you to that screen. And actually, it's going to show you the screen. So that's fine because I think everything is hidden here. And you're going to do what you've always done to log into a patient portal. So you're going to go through the same kind of verification process. I know with MyChart, sometimes it's the same thing. You're going to be typing in a code. And what this is doing is we don't want just willy-nilly people downloading people's information. So you still have to prove that you have a right and access this information. And they do that by ensuring that you have the passcode to this portal. Once you do, your portal may be one name, or you may be like me, where you're a proxy to a lot of people in your family, even in the portal systems at those health systems. So for me, you're seeing my family. And since I'm setting up mine, I'm going to make sure to select myself. And I want to see what I can pull out of these systems and allow access. And by doing the allow access, what you're saying is you've given authorization for OneUp on behalf of primary record. OneUp Health is going to facilitate that download of data into your primary record. And then my favorite little blue button, and it is now basically taking a big data dump out of that portal and bringing it over into your primary record. And a lot of things can go wrong in that. And so we count on our families. There is a big movement on the quality of this data. So we count on our families to give us feedback. So if you're not seeing things or the experience, or things look confusing during that, please, I'm going to show you how to write to our support team. Please let us know. This is our biggest piece of advocacy, is making sure that the quality of data. I will share what we're getting out of these patient portals is very high level data. It is not all the clinical notes. It's been a struggle learning through this new patient access, getting access to all of those documents. So I'm going to show you some shortcuts on how to get those files over, because we can still put those into primary record, but there is some extra steps that can sometimes feel laborious, but once they're in, you're going to see some of the value of why you want to do that. So once I'm connected, I'm going to let the data kind of start flowing over. If I click in, you can always kind of see, what it's starting to pull over, and those numbers might tick up as time goes on, because this transmission is going to be live for like 3 hours trying to see what data it can bring. While it's doing that, let's get some other things started and organized. And one of the big one is, one of the things I know for families having at their fingertips is that medication list and the list of, there's always a question of who is your doctors. So our care team is a manual process. So the data dump we learned is a lot of people touch you. And especially if you've had a hospital stay, we get names from the CNA to the nurse to the doctor. So we learned it's too much for families to get that giant dump of all those names. We are working towards seeing how we can automate that. But right now it is a manual process so that you can just scope who are the people on your care team. And what I mean by care team is when I click add a care team, we define it in primary record in 3 buckets. You have your providers, and those are going to be like if I click on providers, you're going to see it's everything from your dentist to, maybe you have a hearing specialist. So anyone that is kind of in that healthcare realm is going to be listed under the provider. Support may be anything from the dog walker to the favorite barber or haircut, because I want you to think about when you're taking care of someone, often there's a lot of people involved in a lot of things. It can be more than just health. It's about their well-being and their happiness. And so if you're kind of the person that holds all of that contact information, you have now a place to dump it so that as you share that load with your family members, there's one place to know who's who and what they do for that family member. And last is insurance. Sometimes we have case managers at insurances. Sometimes there's a specific person that we get a phone number, through. So our goal at Primary Record is, as you're getting phone numbers and making connections and building that team, you have a place to put that so you never lose that contact. So let me add my first contact. And I'll be the first to know that I don't know my doctor's phone number off the top of my head. So something that I always do is I will Google my doctor in the city, and they will usually pop up in a Google search. And then that's where I can quickly kind of pull this information to populate a care team really quickly. So again, this can be done over, moments of time as you're waiting in the visit office. But the idea is now you have a place to dump it. And once it's in there for life. And so I'm going to just snag this. Actually, the most important thing always for me is to snag first that phone number. So I am going to put Paul, I adore. And then we'll just throw in, for the sake of the webinar, the phone number, but you can obviously make it more complete. I do like downloading the pictures of my doctors and uploading them, because then it shows it in the list. However you want to do, minimal stuff, or go all out and filling everything out. Whatever helps your family quickly call or know who's who. So once I hit save, if you notice up here, it says is active. And what we want to do is, sometimes we get people on our care team and then there's an acute thing and then we'll never see them again. So there is a moment where you can come back and uncheck is active, and they'll go on an inactive list. But you always want to know who took care of you. So that's what's important, kind of this idea of there's the active medications and conditions and people that are taking care of you. And then there's kind of this history. And it's important to keep track of that history, because sometimes that history will inform your care here. So on to, let's check on our connections here. So it looks like we're getting some looks like about the same there. So let's take a peek in here. So with conditions, things that come over are the things that are charted directly into those electronic health records. So we have had our families tell us they'll see things that are things like this, like adult exam. This isn't a condition, but it was the reason or the code that my doctor used to bill my insurance, but also, to label why I had a recent visit. But I don't want it on my active condition list, because I want my condition list to be who I am and what's kind of my things that I deal with. So when you hit bulk edit, you can actually go through here and see, is any of this, resolved for you? And is there anything else that, you don't want to have on here? So once you do that, you will hit status and change to inactive. And then I can quickly update. And now my condition list is more about what I'm aware of in my health and what is active. And that same process would work with medications. And you can go and make things inactive and whatnot. We advise at Primary Record to always make it inactive. Some folks will go right to the delete because they just want it off the record. But when it is deleted off there and you go to refresh, it is likely going to repopulate, because our system sees a hole and it wants to make sure that your information is accurate from what's in the portals. And so it'll repopulate. So by making it inactive, when that refresh happens, it will make sure that it stays the same. And it'll stay inactive. The other thing to note is, sometimes there are diagnoses or conditions that we hear from our doctors, but we might not see in our list. So you can add a quick condition. So let's say I'm on a blood pressure medicine and I don't see AFib, but my doctor was saying, that I had signs of AFib. just to give an example here. So I can put the date that, I remember the doctor talking about it, and I can put here. And why I did this example is I want to note that primary record always keeps track of the source of the information. So up here, you're going to see, oh, this is something that I added. And this is really important when we start thinking about collaborating with more family members, and we want to know, where did the information come from? Because if I click on something from that I had downloaded, I'm going to see the healthcare system it came from. The other thing I want you to know is, as you connect multiple portals, which is one of the exciting things primary record can do, is if you have multiple portals in many places, it can take that information, but it has to go through a process called deduplication, because we don't want you to have many instances of the same thing that you're getting diagnosed in multiple healthcare systems. So when you click on that, you're also going to see the history of how many times that's been noted. And if I had multiple portals connected, it's going to show you the source of where that information came from. And if there's something that you're managing, so you have a chronic condition, and as you move in time with primary record, you're going to be able to link these different things together. And if you have a condition where there is a doctor actively managing it, I can click link, and I can connect to my doctor that is managing it. And what that's going to do is attach, that doctor to that condition, so that if I'm over in my doctor, I can see the list of conditions that they are managing. So we're trying to make information as connected and powerful for families. Again, connecting your portals, getting an accurate list of medications, conditions is going to do wonders for you in your healthcare visits. So the thing I also want to note is, here, let me see why, because I would love to show you the example, because as a mom, we all see actually Dr. Hall. And so I know and this is why it did not save. I forgot to do this. And then let's do family medicine. And where was that phone number? There we go. And so when I have a provider that is listed, I can click on them. And actually, let's go ahead and do that one thing where I showed you we can connect. So I'm linking Dr. Hall. And then now Dr. Hall is my doctor managing this condition. And on conditions, let's see here, Dr. Hall. Now I have up here. So as I tag Dr. Hall in different notes and visits and medications, then I can always just go to Dr. Hall's profile and see a high level view of all the things that she is managing for me. The other piece here is, if you notice, the duplicate button. So if I had multiple profiles, I can copy, I can select another family's profile and copy the contact information in. So really you're just inputting contact information in one time, and then can duplicate it to multiple families' profiles. Again, trying to save families as many typings as we can. All right, so we know we've got our portals connected. We've got we're building out our care team, here and there, just inputting people, or as we get a phone call or go to make a phone call, because when you are in primary record, you can call directly out of here when you're on the mobile side. The next thing I want to tackle is our profile info. Here is where, when you were onboarding, there was information that you filled in and it's populated. Well, if I go and edit, I can actually, put in my address, and as well as, let's see here, add an emergency contact under contacts. So let's say I want to put in my husband so that he is listed, and this will be printing on report. So again, anything that we make families do, we make sure that that information is doing something for you when you're trying to relay information to another. And I will not put Chris's phone number on a webinar. So And so after that's been done, we've got our profile info. We've got now an emergency contact listed. Another handy thing, and this has saved our family many times, is we can add a picture of our insurance card or ID cards. As you know, one of the first things in most visits is they're going to be asking for proof of insurance or an ID. And, they often like the hand in because there's often a scanner of some sort. But I have had moments where I forgot that, and this was sufficient to show the front office desk. So no worries on never having left that at home. It can just be saved here. And when you go and add insurance card, you're just going to be adding a photo, and then you're going to, you can say the front of the card and then add another picture, and that will be the back of the card. The other one we just recently added to the profile is advanced directives. This becomes, we love working with our families that often have kind of complex medical issues. And often there are care plans or advanced directives that they want to make sure are a part of their primary record, because they want to make sure that the family can relay in a time of emergency. So we have the ability to define the code status. And again, if you don't know this is probably okay. And as if you ever face this, these will all be familiar words. And then as well as upload that advanced directive in there. So again, it's in one place so that you know mentally where to find it if you are in a crisis. As well as you can name your health proxy here. And this is also used in a lot of our forms and the reports that we're building. So again, these are one-time things. And as you build out the profile and the care team and you made your connections, you're slowly kind of building your own health information system. And then it's thinking about that next profile that you might want to get started and see how to start kind of dumping everything in your brain into there. The next thing are files and notes that I want to talk about. So let's talk about files. When files are selected, you can check our suggested ones. These are very common ones that folks will want in a primary record. So for me, I want to upload my insurance benefit packet. I have some of our legal information. We have an estate plan, and I've been doing some research about some issues going on. So those are going to be my folders that I select, or you can create your own folder by just selecting add folder. And what do folders do? Folders are kind of like a Google Drive or anything like on a computer. But what's different about the folders in primary record is when you upload, let's say I want to add our benefits package. So I'm going to go and find the member handbook. And why I'm going to do that is because this file is now going to be read by the primary record system using technology called OCR. And what it's doing is it's going to be lifting those words off the page so that if I go and ask questions, and I'll share where you're going to do that, it can find the information in those files. And so anything from research that you want to add, insurance, we have families that actually make a finance folder, and that's how they keep track of bills and other expenses for the year. It's just, again, we're trying to create that one place for families as they're dealing with a lot with the health information. Notes here, I want to just make one quick distinction. There's notes in this column as well as there's notes here. Notes over here are really my notes. When I put a note over in my notes or it's on the bottom in our application, no one else will see those. It's just kind of my own personal to-do list, things I don't want anyone to see. If I put a note here, then it's in my primary record. And if I go to share my primary record with multiple family members, then everybody sees the same note. So let's talk about notes. And something about notes you need to know is all throughout our system, there's notes in each of the specific things. So let's say I got some labs done and I wanted to make a note of something my doctor was educating me about a certain lab. I can be in labs and I can make a note. Let's say it's my hemoglobin A1C, to eat less fatty food, right? And when I save that, it's going to be in labs, but my notes is kind of this repository of all the notes in primary record. So as you go, it will be in this long list of items. Notes can also be where you maybe took notes handwritten. Maybe I'm not, I always tell people I'm a nurse. I'm the not technical founder of primary record. I'm still a handwriting kind of gal. But after my appointment, I can take a picture of my notes and I can put them in primary record, right? So we're meeting families where they're at and what their comfort level is. But the goal is, how can we help you get information in one place so that you can track and trend it over time? Because I can't wait to show you how we kind of help do that. As well, something that can be very challenging is maybe you have a long history and you have a story you tell about your health over and over and over. One of the coolest things, I had a family member share that they have done, because we built the microphone note option more for recording doctors and getting their permission and recording valuable information. But it doesn't mean that you can't use it as well. And so rather than kind of type out a giant note about your health history, you can push to start recording and it will transcribe and make all of that information as well available in our search. So another kind of unique way to kind of get your primary record quickly updated is just verbally dump everything on in your brain and make it part of your primary record. I also have a nurse that's trying to start some ideas of interviewing people about their end of life wishes, what matters to them. Sometimes those are hard conversations for families to have. And so how can we record it and make it more personal so that when the time comes, seeing or hearing and reading the words that our family member has shared is very, very impactful. So it's just been awe-inspiring how families are using primary record today. The piece that I want to get to, because I've alluded to it a few times, is when I share with other family members. So in primary record, because of this new law of you being able to ingest information from multiple places, right? So technically in those portals, you can have a proxy and there is usually a process the system makes you go through to add a family member so that they can see the same healthcare record in those doctor's offices and hospitals. And fully encourage you to do that process, because primary record is often an extension of those systems. This is your tool to kind of track and trend. And the system, sometimes I know at our health system, they only allow up to 10 family members to be invited. So depending on your care team and the people that are collaborating, what we've done is allow families to really dictate who is important for them to collaborate and share their health information. So when I click invite collaborator, what you're doing is like sharing your profile with someone. And so you'll put, let's say I want to invite my husband, Chris. And you can put a message, I'm trying this new thing. Because, they probably have not heard of primary record. You're going to be the one that's going to just wow them. And you're going to enter kind of that quick message. But what's most important that I love about our system, because we cannot do this in my chart, it's kind of an all or nothing, or in a lot of the other patient portal systems, but you get to dictate what people see and how you want them to interact. So for Chris, do I want his help editing and helping me keep primary record updated? I'll go over that message here in a second. Or do I just want him to have visibility so that if something happened to me, he can at least access my information to share it on my behalf? That is a personal decision. We're here as a team if you need help making that decision as a family. I am all for transparency, and I know a lot of families can sometimes hide and are worried how families are going to interpret their information. So again, these are tough conversations, but very, very important, as a nurse that has seen many of the critical care situations that families can have and how critical information can be. I wanted to show, so when I click down here, collaborators. So in this instance, I can give Chris permission to invite other people on my behalf. So let's say you're the daughter or the that's right in front of your parent. You're so busy and your brother has been begging, okay, maybe not begging, but your brother has been asking how he can help. You could give him this role and be like, get all the other siblings on board, right? So take something off of your plate. So it's a little bit of flexible on if you want that sibling to share the load and helping invite other people. We had some requests from families for that, so we listened and have built that out. But again, it's your right to remove or give access. And then you're just doing a checkoff process, right? Because we want to confirm that you have rights to share this information. These are family members that you trust. And then you would hit invite. And so that would put a family member alongside with you to collaborate and use this information. The piece I wanted to do is now teach you kind of how to use primary record, and then I'll kind of pause for some questions. A couple other highlights I do want to share is our activity feed. So if you started inviting more family members, there's going to be a lot of, and as you use primary record, there's going to be this activity feed. And what's great about it is it's going to show, like, let's say I invited Chris. And if Chris looked at my profile, I'll see Chris viewed Jane's profile. If Chris took notes for me because I was going to a tough visit and I just wanted him to take the notes because I wanted to focus on, the doctor and how I was feeling, then it would say, Chris added a note. So it's going to always show and give visibility to who's doing what in your primary record. It can also act as a bit of a back and forth. So it's a way to also make comments. So added a note. And so let's say as the family member out of state, I see something going on with the hemoglobin A1C. Maybe I have a reaction to that, or maybe I went through it and I want to share, a helpful tip or how can I help, So this gives a way, and we're testing with families to see if they like kind of having that interaction. We know most families, when they are taking care of someone, there's a lot of text messages, there's a lot of emails, and then decisions are getting made. And so we're just trying to centralize and make this into one place for families is the goal. So let's go to this idea of how to use my primary record. Most of the times, most of these buckets are pretty stagnant. Once you get them kind of inputted, they're there. But let's say I have an upcoming visit with I've got a new orthopedic doctor, okay? And I know I've got a history of stuff. And so what I'm gonna do is we have what's called a chat assistant. So as you put information in primary record, we have built an AI that is inserted and paid for so it can stay secure just for our families. But we have embedded it into primary record to serve a purpose of helping you find information, to ask questions about your health, summarize things, or explain. And it can do in your own language. So even if you speak a different language, you can ask in your language and it's going to translate the health information into your language. And so with this, I can say, I am getting ready for a new, or if you look at me, orthopedic visit. What questions should I be asking, right? I hear from families all the time, entering our healthcare system can be a little overwhelming because there's a lot of new terms, there's a lot of new people. You have to learn about their roles. There's new medications and procedures. And so sometimes one of the best questions to ask our chat is, I don't even know where to begin with questions. What should I be asking? So what it's going to do is going to give me some suggestions. So it's just a place to start and get some information. Or let's say, how is my cholesterol doing? And it can trend things for you. So I know one daughter and that were sharing their care of their mom. They were pretty religious of, making notes of her visits, and it always had a weight. And there was concerns of that. And, there's always this feeling, but you always want data and information because that really helps sometimes when it is emotional, when you're caregiving. And so one of the daughters put in, what is mom's weight doing? And the chat came back and explained, that she had lost a significant amount of weight over the past 3 months. So, it verified how the sisters were feeling. But what I love is it also gave information on how to have that conversation with the doctor and how to bring that up as a concern. And so our chat assistant is there for you. I always tell families it's all the things that usually would be Googling, but now what it's doing is taking that question and putting against your personal story, your notes, and really coming back with a more personalized answer. So I'm not going to read how my cholesterol is doing because I know I need to work on some areas, but you can kind of see how it quickly found labs for me and then brought them over. And if I had more questions, I didn't understand a term, or, I wanted to explain in simpler terms, just ask our chat. Can you explain that in an easier way for me to understand? If you think there's some, if it looks like dates are off, like it's not jogging, also just ask our chat, are you sure? And it'll do a double check of information and really kind of help make sure that it's got the story right. Let's see here. The other piece that I wanted to tackle is, as you're using primary record, there may be ideas, there may be issues or suggestions. And so just a quick thing over and under account I want to tackle, obviously, is support. So if you have any issues, you can text message us, you can send an email. We do have a help center that will link out to our website. And if you want to learn a little bit more in depth on how to do something in primary record, we have a growing help center out there. Or you can schedule a call if you just want some more, just some time with our team to really help you understand and get things organized. We are here to help. And then under account, a couple of things I want to point out is preferences. So we have a few notifications that will happen. We are in the process of interviewing our families and learning when do they want to be notified when something is added to primary record or changed. Right now, the most important thing we felt is around messaging or comments. If a family member commented, we want to make sure that the other family members get an email that knows that the comment has been made. With us moving into the app stores, we're very excited that we will also then, this preferences will show in-app push notifications. So you would get alerts from your app about a new notification, and to be determined. So if you have insights on things that you want to be notified about, please, reach out to our team to influence that. As well, if you go to feedback, this is going to kick you to a service we use called Canny. And this is where we collect family feedback. And you can actually look through the list of items that families have asked that, that they want in a different way, or have you guys ever thought of doing this? And then families can also vote up and down. So if you see something of another suggestion, give it a vote up, and that lets us know that, man, this is something families really want. And we, when we sit down as a team and start planning out our engineering and our product team's time of, what's on that roadmap, this is definitely brought up so that we know we're building things that families need. And, something that I always want to be, transparency is super, super, super important to our team. And I want to take one moment to look at the way that we price. So we are a free app. And everything that I did today, if you saw, there were limits that you saw in certain areas. And that is all that we do. Is we do have costs that we incur, but we want to make sure that this app is usable at the freest level. So as you're using it, so like in that case of that chat assistant, calling on AI is a very expensive thing. And so, we allow families to have 4 questions a month. If you needed more, you can either wait to the next month and you'll get a new 4, or we do have an unlimited premium edition. And so there's a subscribe button down here. And so if you pay annually, it comes about $13 a month. If you want to just do month to month and, as things are needed more, that would be $16. So I just wanted to make a special note around that. And something, as I was looking over all the different buckets, is the reports. One of the last things. So at Primary Record, we're constantly, how do we help families collect and organize and discover things about their health and share that information with their care teams? So on reports, we have created some easy buttons. We know that medication lists are written and typed in Excel sheets and Google Docs and aren't always accurate or need to be scribbled out. So what we're trying to do is, if you keep primary records medication list all accurate, your medication, conditions, and allergies, and your list of doctors, then it's kind of your source of truth as a family. And then we've given you buttons to instantly create a report so that you can just hand to that nurse or doctor. So let's say I don't have any medications at this time on my primary record. And so I'm just going to do kind of the summary report. And when you view that report, again, remember, it's going to show that emergency contact, but it's going to pull in the things that it has found and any of the contact information that I've uploaded. So we're trying to create an easy way for families to be able to share their information. My other thing that I have loved that we have built in is, we are sometimes caregivers from far away. It could be an hour drive, it could be many states away. And so we have also had the ability to make a live QR code. And sorry, I'm not sharing the right tab. And so when you click the link QR code, you're going to create a QR code. And what that is doing is it creates a QR code that anytime that's scanned, whatever the most accurate information is on the meds and allergies and doctors, it's going to create that summary report for anyone that has scanned. And when it does get scanned, you as the family are going to see that it has been viewed in what location. And so this is one of our family members has talked about, I would love to be notified if this QR code gets scanned. So definitely on the roadmap. But again, how do we help families get their story shared as quickly as possible and succinctly, because sometimes those minutes matter in knowing what the background and the story is of our family members. And the other piece that I wanted to point out on our website at the very bottom, because trust and security are super, super important to primary record. One of our goals is to be one of the most trusted mobile health applications among doctors and nurses, so that they refer most of their families, and we want families then to trust us. So we have built a trust center. So if you look at the trust center, this is our way of sharing. Here is how your data is used. So because primary record is a family application where families own the information, it is centered around that principle. And so you'll see we went through a process of how to make sure and verify that that security is lined up to that value we have at primary record. But I am going to pause there and see if there is any questions. That was like a mile a minute, it feels like, but hopefully that helps kind of see all the different nuances. But any questions? Oh, yes. Yes, Kimberly, go for it.
So if there is a provider who has been taking care of a family member for a few years and then decides to leave the facility and go elsewhere, and the family member acquires a new provider, will the information of the former provider still be in the client's record?
Correct. And, we stopped saying the word connect because it felt like that information flows like this. But with primary record, we are only allowed to download data out of those portals. So there's benefits and negatives to that. And one of the benefits, though, is the download out means it doesn't go back. And so once you've downloaded out, you will have that information for life in primary record unless you're deleting or altering it in some way. So does that answer your question?
Yes.
Okay,
so
perfect.
So the new physician will be able to see what the prior physician entered in the record.
I would assume, because at the same time, like, this is where the challenge of these kind of systems that are built for families. So over in the electronic health record vendor system, right, they're going to have their internal notes. And so if your family member is still at that same office, in theory, then that new doctor is going to access all of their old records that they have stored in. But what might not be in there, because as you know, is sometimes it is that continuity of care, and there's some things left unsaid and not in that chart. And so what I have loved about Primary Record is a way for families to keep notes with that original provider. So when you have that new provider, even using it to summarize, what did this past year look like with Dr. So-and-so? That might help then relay to the new doctor and get them up to speed, because what I've learned is doctors are very crunched for time. So when we show up, usually they probably have 5 or 10 minutes where they're trying to ingest a whole history of health record. And often they come walking in and say, okay, well, tell me about yourself. And that can be overwhelming for families. So I always, in some of the preparation for visits, I always, field and kind of think about what do I want out of this appointment, and make sure I kind of think about what is there any ask I need or things I need to check. You can always ask chat for, what are those questions I should be asking, as well as you can ask chat for, help me summarize what's gone on these past few months to relay to this new doctor. And it can also do that. And that helps. We have heard so much of, what I tease our biggest competitor are those binders that families create. And I've heard so many families tell me, oh my gosh, my doctors and nurses loved my binder, because what a lot of families don't understand is when we go point to point in healthcare, sometimes the information doesn't transfer, but usually if it's same doctors in an office and one leaves, they should still have that access to that record. And you're just going to be facilitating a new relationship, and over time you'll build up that continuity of care. So that's why I think it's so critical for families to kind of have their story organized before a new doctor.
Mm-hmm.
But excellent question. And I think that's a huge reason for hiring a nurse advocate. Just when you're extra lost, that's an emerging field that a lot of people don't know about. So, and we support a lot of nurse advocates that help families on primary records. So reach out, and we're happy to connect you to one that might be working in a state that you live. I'm trying to think on my list. I want to make sure I'm looking through all the different things, but in the end, it's really the biggest hurdle I know is getting some of that information connected and in. If you cannot find your patient portal, that is something I did not cover. So let me get show where. Let's say this is my actual family one. So sorry. Let's do it back here. Okay, so share this one. Because I know we've had wonderful that families have let us know. So do not the law was passed in 2016, and if anyone has worked in healthcare knows that change and newness usually can take anywhere from 10 to 15 years for adoption. And so we've seen incredible strides, but I do still see a lot of work that needs to be done to make sure the quality of data and those data connections are growing for families. So we're a big advocate in that space. So let's say you go and try to find your portal and you don't find it. So I type in, something. If you go to find something and you don't see it, there's a button at the bottom that says unable to find portal, and it'll directly send an email to our team. And usually we do a deep dive, and, in this email, we always love knowing, what did you try searching? If you have the URL of your doctor or the healthcare system, so the website address, please send that. And then we'll do kind of a deep dive on our end on what's going on with this provider or this health network. Sometimes it could just be spelling. We also learned that a lot of healthcare systems share instances of MyChart and Epic. And so I've gotten crazy responses that in order to connect the portal, you actually need to type in, University of Alabama. And so we learn that on your behalf and then help try to make that connection. So do not be discouraged if you cannot find. But I will share there are a lot of portals that are not yet connected. And so one of the things is one of the reasons of why we built out files. So that was actually one of my first folders I made. It was patient portal downloads, because there's where I get my physical therapy is not on here. And many of those portals allow you to download documents or reports of your timeline of your history. And then you can take that file and put it in primary record. And it will then read that file and be part of when you're asking for chat or, summarize information. So another thing I forgot to mention. So, but any tips of getting started? That's where I would love to start building a community around. But Kimberly, did you hear anything today that helped, or you're like, oh man, this is still?
No, everything was very helpful, and even learning new things, including the QR code, the shareable QR code, which
Yes.
is great, because I am a long distance caregiver to my older sister,
Yep.
and this would be helpful to me, to her daughter.
That's amazing. And we have a blog. It's one of my favorites because my co-founder, Jim, his daughter has Down syndrome. And so it was cool. He taught her how to, he has a picture of the QR code. And so if she gets asked anything about her health, she can just push the picture and have someone scan the QR code so that they know, her allergies and her history. So it's just empowering to me, like getting people to share their story. And then as a nurse, it's so, because if we don't have it, then we're just going to start over. And sometimes that can be harmful or frustrating to patients and families. So yeah, as much of the information and kind of being involved in that, I think is kind of the future, because it's our healthcare system can do amazing things, but it can really struggle and really personalizing sometimes that journey. The last thing I wanted to do was show the big update that's coming. So let's see here, let me get it queued up here. So our families shared with us, we've just been doing a lot of listening, and sometimes when we would open up that profile, it was just a lot, like it's just activity and a lot of buttons. And so much of, what we learned is, once you kind of connect things, and labs are like, I know where to go find things, but it's more about the activity and notes and messages that really engage families in primary records. So how could we make that easier? So on Monday, we've been testing yesterday and all this weekend is going to be our dashboard in primary record. And so this will be the future look of the desktop as well as the mobile version. And what's amazing is you can kind of at a high level, you're just seeing the activity of, were there records noted on that day? Was there a visit that day? Collaboration means like someone looked at my profile, someone added a note, someone did, something else from a collaborator, or there's something about my profile. I refreshed a profile, I refreshed a portal or whatnot. So gives a month view. And if you click the month, then you can get the year of activity. And so that was kind of fun for me to like go back in time to even see, oh man, like we launched this in 2023, but we pull the history out of those portals. So I got to see, like, I think I went back to like 2006 or something of, when my last visit that, the primary record had found. So it's kind of a neat way just at a high level view to see, as well as you can, if you're not a calendar kind of person, you can click on the month and then get to a month that's active. I can click this and get more of the list view. So again, preferences of families or of individuals are always different, but really just trying to help, share what the story is happening. And then as people send messages, so we have advocates that work with a lot of families, and then they send messages. And so it's kind of your message center. So I can click on that. And I can say, done, and fire off. Oh, go ahead, Kimberly.
Can you add appointments to the calendar?
You can, let's see here. you can, so the view of this is just like the summary. So if you wanted to add an appointment, you'd go to visits and let's say add dentist. Shoot the date. It's going to be on this date at 3:08, you know what I mean? 3:12, whatever, PM. I can, tag a doctor in that as well. I kind of rush through that, but then it'll pop here. But I like that suggestion. And so if I refresh, I should have gotten back. It will show me that I've got now a visit on January 24th that I had added, that's upcoming. So there is a way to add them, or if you're connecting the portals, there is like some of the portals for some reason aren't showing us upcoming appointments. Again, feed us that quality of data that's coming over. But if the connection allows it, but yes, you can manually add them under visits and then they will populate there. But what I'm hearing you say, you almost expect to be able to click on the day and then just add it from here. Is that what you're asking?
Or either way, my sister is not technically savvy. She can't do it. So she would call me and ask me, do you know when my next appointment is? So I would have to get on my laptop and go to the facility and look at their calendar,
I see.
So if I add it into into here, another family member can also see it.
Correct. Exactly. Or other family members might know of one and add it here. So how can you get everybody like, hey, if we all do this, then we can all support and make sure she's getting where she needs to go as well. Something that, and then portals is under health records. And none of mine are, I think because I'm in a dev state, this will show, we will now do an auto refresh and go look for information. Before, people had to re-log in to refresh information. So we are now automatically refreshing every Monday for families and pulling in information. And so, but again, it might require checking with that portal just to double check as we, learn and see the quality of data that's coming over. But yes, and I just love the view because then you just seeing like, oh man, look at all those. She has a lot of appointments in March. Like that view of what's upcoming is wonderful, and then notes can be matching with what's going on there. But great question. But we're pretty excited to kind of roll this out, and we're up to nearly 750 families on primary record and growing every day. And what our number one support ticket is, can you please add this, and this? So families are loving having one place. And so this year we have a huge goal to figure out what other partners can we have to help those connections and pull in information. So learning a ton in this space and trying to make it as easy as possible for families. So I'm going to stop recording and really appreciate everyone's time. Thank you.